most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course.
This
Bob.
video is a part of a series of videos on plantar fasciitis. If you want to see the entire series or what it entails, go to bobandbrad.com, go to the program section, and it'll be under plantar fasciitis. We have a whole bunch of videos you'll want to watch. This one is ice versus heat for plantar fasciitis, how you may decide which one to use and how to apply it.
There you go.
So the first one, we're going to talk about ice. Ice generally has three purposes. One, immediately after the injury, like 24 to 48 hours after you start feeling it for the first time, it can help with pain and swelling.
Right.
And a lot of times what's interesting about right after you injure your plantar fascia, a lot of times it's not just pain right here, Brad. Sometimes it's the whole arch is all fired up. So the ice will help calm that down. After 48 hours, it still works good for pain control.
Sure.
So,
yep.
And it also can help with blood flow because there's a process that goes on when you put ice on, the blood vessels contract.
Right.
And after the ice is taken off, the area warms up and encourages more blood flow to come in. They open up even wider than they normally would.
Right. So when they contract, they squish out blood from the area. Then when they warm up, they open up, and so you get actually some good movement.
Hyperemia. Right. A lot of
very nice term.
So what we recommend is you take a water bottle and you have it only about 2/3 full because you don't want it to expand
and break in the freezer.
Open, right. So about 2/3 full, freeze it. We didn't freeze this one, sorry. And you're going to go ahead and you can just have it below your desk or wherever you're going to have it. And you can roll back and forth like this. And you can freeze things down, roll 10 to 15 minutes.
Yep.
You get a little massage too.
Right.
So it works out really well with that.
Is that you're going to drink that for lunch?
No, this one I can go ahead and throw away because we don't want to have my feet contaminated.
Throw that in there.
All right. For heat. So ice you can use anytime you want if you want.
Sure.
The heat after 24 to 48 hours, you could certainly then use heat.
Right.
Now with heat, what we recommend actually is to use infrared heat because regular heat only penetrates like a millimeter or so. And if we want this thing to heal, we're going to want it to penetrate much deeper, which infrared heat does. And I'm going to demonstrate on the yardstick here. So on this side, Brad, you want to hold that side?
I'll hold it.
You can see that
this little blue section.
Yeah, that's what normal heat, how much it penetrates.
Right.
Compare it to infrared heat, which goes
2.36 inches.
3.36 inches. Look how much more that is. Now, if I were to put that up against my foot, I don't know if, let me pull this off here. Now you can see it's actually going to penetrate well into the fascia and help it heal.
Right. And that's the thing with the regular convection heat where it's just the hot pad. If it's not making contact with your arch or in here because you'd have to push it in or not, that you're getting virtually nothing. But infrared will actually, you don't even have to make contact. You will get that depth.
Yeah, if
even
it's
if
down
it's
here, it'll still, it'll still go all the way up. It doesn't have to be conforming right to your skin.
Right.
So we got two methods. We're big fans of Thermatex. One, they have the big shoe, basically, this is called, or the big slipper.
Yeah, specifically made for the feet.
Yeah, and it's nice, especially in the winter, if you have cold feet. You can put this on your desk. You just slide it in there. It's got a liner in there, too, if it gets too warm.
Sure.
For the bottom of your foot. And you want to make sure that's in there. But my daughter uses this all the time. She has a problem with her feet, and she just sticks it underneath her desk and
it doesn't matter if you have problems or not. In the winter time and you got cold feet issues, whoa, it's a treat. But it's this way you can get both feet at the same time. You do not need this one.
Right.
You can go to this.
This is the platinum model. The reason I like this one probably a little bit better is because now you can use it over the entire body. You can use it for your back pain or your neck pain.
Right.
Or your thigh pain, knee pain.
Here.
Right, calf pain.
And the nice thing about it is you can roll it and you can actually put your hands in there. But in this case, you're going to go like this and go like this. It's got a nice elastic strap.
Yeah, it comes with a bunch of, it actually comes with some extra straps if you order through our link.
Yep.
Because Bob and Brad like to have it that you can actually wear it for back pain.
Right.
So
we suggested that to this company.
So But this is, this would work great for this, and then you'd have something for the other parts of your body that are hurting. So we have a link below. This is how we are able to offer these videos for free. Just to remind you,
Right.
we get a small commission on this. So
But they're good quality product. We've been using them for
we
2, 3
love it.
years
We
now.
love it. Love it.
Mhm.
Love it. Love it. So, all right. Thanks for watching.